Okay. All right. Well, happy Monday evening. So like I say, if you guys have any questions throughout this, just interrupt. This is going to be kind of lecture style, but I'll definitely, if people want to chime in at any point, let me know. I want this to be interactive as much as you can, so that way you are not just, sitting there like you're back in high school or something, listening to me talk. I want you guys to be able to talk too. So I'm going to talk about stress today. So I'm going to talk about what we can do with it, how we combat it, all different tools, and what it actually does to us. So again, Dr. Melissa here. I think I know all of you guys in the chat though. So yeah, I hope you guys enjoy. And everyone can see my screen, I think, correct? If not, somebody yell at me, say that I can't see it. But I'm pretty sure I'm sharing. All right. Okay, so everybody has stress. Everybody knows that we have stress. I actually just came down from a horribly stressful last 36 hours. I mean, life could be a lot worse, but I had a bunch of travel complications. So my stress has been up and down, and everybody's stress takes a toll on them in a different way too. So I want to talk to you guys first about what are the two different types of stress, and because some people don't even realize that that's a thing, and what can we do about them? So distress is the bad stress. So that is suffering, that's misery, agony. So that's external, and it's usually very temporary. And it's a great cause of physical or mental strain. So that is, think of like a trauma or a death, or a relationship ending, a job ending. Think about things like that, like more on the trauma side of things. Eustress is actually the really good stress that we have. So this is moderate or normal. And this is interpreted as being beneficial. So this is things like day-to-day stressors that we run into with, oh, I have to go work out. That's a stress on my body, but that's actually really good stress for us. So those are the two different types of stress. So I want you guys already, imagine what are the two types of stresses that you have going on in your body, and what do you do when you feel these two different types? Stress is normal. My favorite quote is, we can't take away the stress that's happening to us, but we can absolutely figure out how to combat how our body interprets it. So again, we can't change the stressors. We can't change change that they're happening to us, but we can definitely change how our body responds to them. So on a cellular level, our body actually perceives all of the stress the same way. So that's actually why there's a problem with the stress in our society lately, is we have so many good and bad stressors coming in at once, and our body has no idea how to interpret. So even though, people, let's use the example of working out. Working out is a really good thing for the body, but it is, after all, a stress and on the body as a good stress. So then let's take a relationship stress. So if that's a negative stressor, our body also says, well, it's still stress. So it starts putting up this stress response to basically everything, over and over and over again. And our body, especially Americans, we're very guilty of having a lot of stress triggers in our lives. So we have a lot coming in us at once. Imagine, it's kind of like a bubble. Yourself is in a little bubble, and you've got all these like prickers coming in, and all of a sudden that bubble is just going to pop. And that's when your stress response says, I've had enough. So again, our job is to calm that stress response down. How can we really shut that off? We don't want it to be extremely, overbearing over time. So let's see here. So everybody in this chat should know what cortisol is, because Dr. Sarah and Dr. David and I probably talked about it at some point. But if not, here is what this lovely stress does to our body. So stress releases cortisol. So cortisol, what is that? It's a glucocorticoid. So it's actually a hormone in the body, and it's released after a stress response. So again, let's go backwards. Even though, working out's a good stress, or running around, let's say running a bunch of errands is a good stress or something like that, you're still releasing cortisol because that's your body's way of reacting to it. Now let's take that negative stress, also a release of cortisol. So here we are, we've got a lot of release going on. Cortisol is a very natural occurrence, and we actually want this cortisol release. but too much can be put out or too little depending on the stage of stress. So let me go through what I mean by this and how you know if you have too much or too little or what's happening. So, oops, there we go. So what does cortisol actually do to the body? So cortisol activates what's called that stress modulating pathway. Some people don't know what modulate means. Modulate basically means baseline. So that means it keeps you in the middle. So we've got too high stress or too low stress. It's a modulator. So it keeps you at that baseline, which is where we want to be. But cortisol helps to activate that modulation pathway. It actually activates an anti-inflammatory pathway. So it's very protective. Cortisol is actually really protective to us. If we don't have it, our body has no way of responding to the stress response. It blocks something called gluconeogenesis. It's a really fancy word for meaning it blocks the uptake of glucose into tissue. You know what? And I'm going to move downstairs. I just got a notice that my internet is going in my upstairs of my house. So hold on, bear with me. Sorry. This happens sometimes with my upstairs bedroom and it yells at me and I don't want you guys to lose my connection. You guys are like getting a little cribs tour here. Okay, we're back. Okay, well, I'm going to turn the light on. Okie doke. All right, so I'm back. Okay, so actually back to that sugar. So it blocks that uptake of glucose into tissues other than the central nervous system. So sugar in our tissue is really good. We want sugar because that is how we have cell pathways that happen. That's how we get our energy. It's really, we want that. But the bad thing is if we have too much, again, of that cortisol or too little, that pathway signaling gets a little bit haywire. It basically doesn't work. I'll explain more about that in a minute because that's a big problem that our society is having is with the sugar response from stress. So cortisol also maintains blood pressure by activating constrictive effects on blood vessels. So what does that mean? It basically helps to shrink down blood vessels so that way you do have this proper blood pressure response in the body. So again, very important, taking back to that stress response. So when people feel stressed or feel amped up, you almost can feel your blood pressure rising, even though really you kind of can't, you kind of can. But that's what's happening there. It is constricting blood vessels and it's helping to maintain that. Again, healthy, it's a healthy response. Also regulates our immune response. I will come back to this one also because very important. Again, remember this talk is all about what does stress actually do to us? And I'm gonna circle back, especially with this year. The whole theme of this lecture series was us talking about this year, what's kind of happened in society and to all of us. So we're gonna talk about what has that done to our immune systems also. So this is from a study, but these are all positive responses, but I'm gonna read this out loud. Elevated cortisol levels for extended periods, however, negatively affect virtually every aspect of physiology. It becomes more difficult to maintain proper blood sugar levels, to slow down for rest, recovery, and repair, to get good quality sleep, to balance other hormones, to maintain mucosal surface integrity, to maintain bone mass, to produce effective immune function, to effectively regulate inflammatory processes, or to detoxify the body. Without proper intervention, continued adrenal hyperstimulation, I'll explain that in a second, can lead to adrenal exhaustion and eventually adrenal failure can occur. So that's the gist of what stress will do to us long-term with extended amounts of cortisol release. So let me go backwards. So what are the adrenal glands? Again, I think most of you guys in this chat know what the adrenal glands are. You've probably heard one of the doctors talking about them. But what are they? They're little glands. They're probably about this big. They sit right on top of the kidneys. That is actually what releases cortisol, this hormone. There are actual adrenal diseases out there are pathologies where you can have a tumor on the adrenal gland or you have too much hyperstimulation of cortisol or too low cortisol. Those are actual pathologies. What we're talking about here though is over time, imagine like the little engine that could. Your body's trying to put out cortisol as a stress response. And then it says, I can't. And it says, I give up. So that's what this is, what I'm talking about here. And where all of these cell processes, all of this signaling can really, really, really start to be disrupted. So essentially, here we are with chronic stress. The body becomes cortisol resistant. So with perpetual cortisol output, the body cannot rebalance back to its eustress, or that good stress state. So I want you guys to take a minute to kind of reflect and think of a time in your life, whether that is now, or was this last year, or was 10 years ago, when you were going all the time, when you really weren't giving yourself a break. Think about, again, like, let's go start with like family, or start with a relationship where you kind of were, giving it your all. And then you had perhaps children, or, I mean, it could be a pet, and you really were giving. And then you had a job that was very demanding and a lot of hours, or perhaps a negative work environment. And then on top of it, you were trying to buy a house, or you were moving, thing after thing, kind of life happenings that can be very good in short term, but in long term, they really, really wreak havoc on your body. So think about that and put yourself, well, I don't really want you to put yourself there, because it's probably a miserable time if I'm talking about a negative time, but remember what that was doing to your body. And think about that and think, was that a time when maybe you couldn't lose weight, when you were hungry all the time, or not hungry, couldn't sleep, your mood was affected, you were getting sick all the time, you couldn't focus, you were in pain, that's a huge one. Perhaps you had to visit us more because you were in pain, things like that. Think like you were just down and out, couldn't work out. That's because that cortisol gets resistant. So it says, I can't do it anymore. I'm going to keep putting out as much as I can, but your body just doesn't respond. Same analogy if you guys are familiar with diabetes, same kind of idea. Diabetes is basically when your body just stops responding to your insulin, which insulin is what regulates blood sugar. Same idea. Your body just says, I can't. You're only given this precious body. You have to take care of it and do as much as we can to heal it. And it's definitely, it's like I don't want to say it's a time bomb, because that sounds really, bad. It's not that at all, but it basically can only do as much as you can throw at it to handle. Sorry, my dog barks. Saw that one coming. There's someone outside and I saw that about to happen. So my apologies. So that is that stress response. That's what that does, is basically it says, I can't do it anymore. I can't handle that cortisol anymore. So how do we actually test this cortisol level, and what is this, and how can we help the body respond to it, so that way we can help, so that you can get yourself back to baseline. So maybe that stressful event happened to you a long time ago, and you might still be recovering, or again, maybe you're going through it right now. But how can we actually test this? So in a functional medicine practice, or if a functional medicine practitioner suspects excess stress, and that's having a negative effect on the body, a salivary cortisol test will be conducted. I won't get into the science too much about this, but there are different ways to test cortisol levels. You can actually do blood tests, and you can do urine, but saliva is what's the gold standard. So that's kind of the most effective to tell us what's going on with your cortisol levels. So here is an actual chart of a saliva test. We do one in our office called the Dutch panel. It's part of a hormone panel. This is one through a different company called Genova. So I want to explain a little bit about this cortisol levels that I'm talking about, and what they're supposed to be doing in your body. So at different times of day, you can see here in the morning, there should be a spike in cortisol. It should kind of mellow out here, and then it should flatline as the day goes a little bit, and then it should fall as before bed. That's a normal stress response. There's also something called DHEA, which is a hormone also, that helps with the chemical processing of cortisol. That's a little different there, but this is, again, this cortisol curve that we want to see here. So this is a fairly normal curve. Let's see here. And then this is the different phases of different curves here. So I'm going to go through each one. So stage one is called alarm phase. This is kind of normal. This is your day-to-day, like, okay, I'm going to respond to stress normally. I'm going to put out cortisol and DHEA. They're going to increase. We call this stressed and tired. And you might be asymptomatic here. You might not really feel much of this. This should be normal. So I'm going to go back to this picture. That's going to be like, right in this beginning, where you might be like a little bit high throughout the day, a little high, maybe a tiny bit below bed. Again, green is the normal. So that is going to be stage one. Of course, we always need to step in with stress responses in the body because we don't want it to perpetuate over time. But that's the part where we're like, oh, we kind of keep our eye out for some changing levels, but this isn't the scary zone yet. So stage 2 is getting to resistance. So this is when cortisol starts to increase, but your DHEA declines. So this is like stressed and anxiety attacks, mood swings. This is kind of the wired and tired. So this is when we see a lot of mood disruption happening. And we don't like that. That's not necessarily our favorite thing. So that's going to be, again, when cortisol is way up here, and then DHEA, this other one, sorry. I want to make sure you guys can see my mouse. There we go. And DHEA will start falling here. So that's going to be the kind of something that we see, a very common pattern. I see most patients fall in this second pattern, which is a good thing because the last pattern is getting into severe exhaustion. Now, I will say I have seen people in this severe exhaustion too. Stage 3 is exhaustion late stage. Most of my patients that I've seen in this exhaustion late stage are actually post-pregnancy. Or somebody who just went through a very big trauma, whether that was to the body, an injury or a relationship trauma or whatever it may be. This is called adrenal insufficiency. So this is when both of those hormones kind of crash. This is major depletion. You're depressed, exhausted, really feeling the effects. The thing is people, they hear this and they're like, oh my gosh, is this too far gone? Can you fix me? Can we fix this stress response? Absolutely. It takes a lot of work, but we can fix it. So what do I do? So let's start with, well, what is functional medicine and what do we do about this? How can we help you? So conventional medicine is disease-oriented, it's doctor-centered. Everyone's kind of treated the same way. It's a specialized, so you go to your doctor for gut issues, you go to your doctor for hormones, they're very separate. And it's a diagnosis based off of symptoms alone. And then it's early detection of disease. So that is, where they will be able to see cancer markers and things like that. Functional medicine, on the other hand, is what we do, is health-oriented. It's patient-centered, so we really are focusing on the patient. It's holistic, so that's where we come in and we look at what can we do that's natural and holistic. It looks at the underlying cause of the disease, so why did this happen in the first place? Biochemical individuality, so that means that you are not the same as the next person, and not everybody gets the same dosage or the same medication or the same treatment. Not at all. I don't think I've ever given the same person the exact same kind of protocol. And then preventative approach. So we want to make sure that we're preventing disease. And that is what we talked about a little bit. So in the case of functional medicine, we're going to search for the root cause of why are you getting stressed? What is going on with your body? So these are things that chemically could be happening. And then we'll get into the mental, emotional side too. And then we're going to get to what do we do about these? So inflammatory foods, lack of nutrients, high sugar intake, high medicine or antibiotic intake, high toxin exposure, lack of hydration, lack of exercise, the list goes on. So that's kind of a root cause of stressors on the body. Look at that list and think, is this me? Do I have a lack of hydration? Do I have a lack of exercise? Happens to a lot of people in the winter. Do I not eat the best diet? Do I eat inflammatory foods? Do I take a medication every day? Some medications are wonderful. I'm not a medication robber. We need some of them, but do I take one that might potentially be harmful for me? Toxins around us in the air. The list goes on again. Those are all stressors also. So not just imagine you've got your day-to-day life stress and then on top of it, maybe some chemical stress too that you don't even realize. So again, here's where the outside stressors come in also. So work, family, trauma, relationships, friends, goals, school. And we always joke in our office that we're definitely not trained therapists, but we play the part. We like to help. That's our job, is to kind of dig deeper and see where we can come in and help. So this is something that we do in our office. So blood work tests, what stress is actually doing to us, what inflammation is happening, are your sugar levels going off, what is it doing? The salivary cortisol test, which we talked about, and then gut health. I know some of you guys may have listened to the lecture last week on gut health. And that's a key indicator of stress in the body. So if that lining of the stomach is broken down, if you have heartburn all the time, if you have diarrhea all the time, that is probably a stress response in your body. Some people will say, well, I don't feel stressed. I feel great every day. I wake up calm. You know, I don't have a stressful job, all that stuff. When I say, okay, well, then what are you putting in your body every day? Maybe that's the stressor. So you got to kind of change that mindset on where this is coming from. There's also other tests too that we can see to measure and gauge that stress response. Acupuncture is also something that is really, really awesome to relieve stress in the body. So there's two sides of your nervous system. There's your sympathetic nervous system, and then there's your parasympathetic nervous system. Your sympathetic is that fight or flight, running from a bear, kind of like go, go, go. That's your sympathetic. Parasympathetic is the calm, rest and digest, recuperate part of your nervous system. Stress pulls from that parasympathetic. So stress activates that sympathetic. Acupuncture has actually been proven to engage the parasympathetic and calming nervous system. This is especially key with people with PTSD because it can really pull out that energy shift that has happened to people with PTSD, which are in a chronic sympathetic overdrive. It also helps tremendously with depression, anxiety patients, and it helps with pain, chronic pain, because again, pain is a stress on the body. So what do? Pull down that pain. We kind of already talked about this, but basically through an intake, we'll examine, well, which system is off in you because of stress? Which one is being a little bit attacked? And then I will go in with acupuncture and balance that out. There are actually points in acupuncture called Calm the Spirit points. And I'm going to show you guys two of them because this is where we get to the fun parts. Now you guys know what stress does to the body and what all of this can really, really attack. And now what do we do? So there are points called Calm the Spirit points. If any of you guys have ever had acupuncture who are listening, you know that you get an ear seed when you leave. That's a little seed that you can push on to remind you in your ear where those stressor points are. And then there's points all over the body that are for Calm the Spirit. So this is kind of switching gears of how acupuncture helps that. And then we're going to come back to the rest of the body. So let's see here. Let me skip because I want to make sure that I give you guys the Calm the Spirit point. So let me show you guys this one now. So this is a really, really awesome point. So if you guys take your hand like this, almost like in I almost said a glove or a mitten, and then I got confused which one was which. This is a mitten. But take your hand like this and then bring your thumb towards your index finger. Flip your hand like that. See that high ridge that forms right there? That is an acupressure point to respond to stress. So when you're feeling very stressed out, if you hold your index finger and your thumb like that, like so, I don't know if you guys can see that, and pinch. That is a very good Calm the Spirit point. Anybody throughout the day who's feeling really stressed, or you're kind of that go, 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 and you're running around and you just need a minute to breathe, I urge you, hold and pinch this point. It should be tender. You should feel it. It should really relax you, but this also physiologically can really lower the stress response in your body. Super, super, super important. So if you guys take one thing away from this, I want you to remember this point. It's really awesome. So before I go to the next slide, I do want to go back to this kind of stress topic of what this has done to people over, especially this last year with your immune system or weight gain or things like that. And I also do want to talk a little bit about my own personal, something that happened with me with a stress response in my body. So this last year, think about how everybody has been just very, very, very uptight, very, very stressed. And how many people that we've seen that have come in with new health issues popping up. Well, now you guys know it's coming from this cortisol response in the body that's making you feel more stressed, and it's driving this immune system response. So now cortisol, remember, is supposed to protect our immune system. But if it stops being put out and it's just not enough, and if it just doesn't, your body says enough's enough, I can't do it, then your immune system has nothing to help itself out, and it'll run rampant. So your immune system needs a healthy stress response. That cortisol will just keep climbing, or it'll fall. And like I said, there's something called TNF alpha, interleukin 6, VEGF. They're all immune cells in the body. They will just turn off. So that means when you come in contact with a virus or a bacteria or whatever it might be, your immune system is under attack. This is so important, especially for this last year, because people have just been so stressed, and it's like, well, look at this. Then we've got this rising, terrible virus, and then people get even more nervous about it, but then they get more sick because they're nervous about it and they're stressed out about it. And it's not saying okay, just, don't be stressed about it. Not that that we don't want that at all, but we want you to know how to respond to it and how to know when your body's on overdrive or know when you're stressed out. Bring yourself again back to baseline. Being perpetually stressed also can have a really, really harsh effect on your thyroid and hormones, whether you are male or female. So why do we think also, unfortunately, infertility is really on the rise? Again, stress. The amount of times I will run a female hormone panel with somebody who is dealing with fertility issues and their hormones are very affected. Their adrenal glands are just shot. Again, stress. So we just really, it's so important to bring that to baseline. So my personal story, this is pretty crazy. So last year I was going through something really stressful in the winter, and I kind of came out of it and I was like, okay, it's done and over with. This horrible thing that happened, everything was kind of getting back to normal. I got knocked down, drag out sick. I'm one of those people, I'm like, I don't really get sick much. I get little head colds and things like that, but I've never gotten sick. I got so sick to the point where I actually ended up in the hospital. I ended up in the emergency room. And it was terrible. And my body, I knew when I was laying there in the emergency room, I was like, oh my gosh, I did this to myself. I did not let myself recover. I was, running around like crazy. I dealt with a very negative, stressful situation that was probably 2 to 3 months in length. And my body finally was like, I can't help you anymore. You need to help yourself. It was probably the biggest wake up call that I've ever gotten. And I think I would have been when that happened. I was 28. So, kind of scary. It was very scary. And I still am dealing with some issues since then from that episode. So this is why when we practice what we preach about stress, it's true. You can't put yourself on overdrive all the time. You have to slow down. You have to take time for yourself and protect yourself. So that's my 2 cents on stress. So now we will jump into what do we do about this and what do we do about these stressors that, we can't control. So a chiropractor can help with stress. Again, you guys listening, obviously you guys have been to a chiropractor, so but this is how this works. So the nerves coming out of the spine, especially at C0, which is your occiput way up here, to C7. By the way, there's not actually called C0, but that's kind of a chiropractic joke term. It's your occiput up here. And then you have a first cervical vertebrae. You don't have one called 0. But they all connect directly to the brain, those nerves. All your nerves actually do in some way, but these ones are kind of the most important. So chiropractic adjustments, especially cervical, can help those nerves calm down and that go into the brain. That also helps to stimulate the parasympathetic nervous system, this nervous system that's the calming system that I keep talking about. So this allows for greater brain communication to decrease that stress response in the body. Super important to get adjusted. This is why also, some people say, well, I don't really know. I'm not in pain. Why do I need to get adjusted? First of all, we can always find something that probably hurts on you somewhere if we poke around enough. But also, again, it's just for your nervous system, for healing your nervous system. So that's where we come in as chiropractors too. This is a really cool study. So in October 2016, there's a research board called the Vertebral Subluxation Research Board. They presented a case of a patient who had been suffering from ongoing panic disorder for 3 years with no relief under standard care. I believe the standard care was definitely, there was medication and then I think therapy, from what I remember from this study, which are great things too, in a time and a place for medication, and then therapy, always wonderful. In particular, she suffered from chest pain for the past 8 months, probably a panic attacks. She also had a history of trauma. She underwent a combination of ongoing network spinal analysis, somato-respiratory integration to both correct her subluxations, which is basically what we do as chiropractors, to help calm her panic attacks. Somato-respiratory integration means breathing work. She started to see a significant reduction in symptoms starting at 6 weeks after beginning treatment and a resolution of her panic disorder after 14 weeks of continued chiropractic treatment. So it works, and we know that, and it's, we advocate for it as much as we can. Okay, so enough about that. What can I do at home? What can you guys do from day to day? So now again, this stress that can happen to the body. What can I do, as in you guys at home when you're just feeling really stressed and drained? These are just some of my favorite things that I picked up from either going to therapists or mental health professionals myself, or from lectures or from reading. I just love all of these tools. So journal. I always have to stop myself right away because people are like, I hate journaling. I hate writing stuff down. Not even really what I mean. So journaling has been proven time and time again. If you get your thoughts out of your head on paper or in your phone, or talk them out, whatever it might be. It doesn't necessarily have to be sit there and journal, under a tree with a little book. It doesn't have to be like that. Just getting them out of your head, that has been proven to lower stress levels. So imagine walking around all the time with a 5-pound weight and you're just carrying it all day long and it's really weighing on you. Same thing with those thoughts. Even though they don't weigh anything, they weigh heavy on your brain. So the second we get those out of your realm and out on paper, that takes quite literally, it takes a load and a weight off of your brain. So journaling is something huge. And again, you do not need to sit there for 3 hours a day or anything crazy. Just jot down a couple quick thoughts or take a note in your phone, or like I said, talk it out. A big regret I hear patients say is that, that they always kind of blow up on their significant other or their kid and they kind of vent to them all the time. Well, sure, that's what relationships are for, your parents or whoever it may be. But time and time again, that can also affect your relationship. So we don't want that. So instead, get it out on your own accord and get it out on your own paper or phone or however it might be. You'll feel so much better. I promise you. So again, doesn't have to be actually in a journal or a binder. It could just be however you want. Get those stress thoughts out of your head. So that's my first tip. So here are the studies. I love science, so I love studies. So journaling decreases the symptoms of asthma, arthritis, and other health conditions. It improves cognitive functioning, so brain. It strengthens the immune system, preventing a host of illnesses, and it counteracts many of the negative effects of stress. So this is, actually what they probably did was I know this study actually very well. They took test subjects and they, measure baseline at the beginning of a journaling program and at the end, and symptoms and kind of reactions. Journaling is amazing. All right. And then I love to tell people to do it 2 times a day. I know in a perfect world, that's really hard. But even like I say, if you have 5 minutes, write some stuff down. Another 5 minutes, write some stuff down. If you are an insomniac, I know it's hard because you don't want to turn on the light and get kind of ramped up. But if you are an insomniac, there's been a lot of results on people that can get up and just write something down, even if you can't really see it. Just write down, get that thought out that's making you stay awake. So really, really helpful there. So this is one of, this is kind of what I was talking about, getting that racing mind to stop, get your thoughts, into a reality, get that on paper. For anybody who's ever done serious goal setting too, there's a lot to be said about getting it actually on paper and written down, and that will hold you accountable. All right, so here's my, there we go. Hold on, I want to show you guys this. This is the apps I was talking about. So there are apps that you can actually use for journaling. There's one called Dailyo. There's 3 Good Things. There's different apps. So even if you're not a writer, use your phone. Super helpful. This is something fun too. If you guys want to keep the positive and shred the negative, I love doing this. Write something really positive down, keep that one. If it's a negative thought or like a really, really bad stressful thought, shred it, throw it out, get it out of your realm. And we talked about that. Okay, meditate and breathe. This is my other favorite thing. Even just 5 minutes a day has profound effects on stress. So here's another study. So meditation reduces stress, controls anxiety, improves self-awareness, lengthens your attention span, reduces memory loss, reduces cravings and addictions, improves sleep, and decreases blood pressure. So I want you guys to do a little experiment also. So next time you're really craving a food that you know necessarily you shouldn't have, I want you to take a minute before you eat that, or 2 minutes, and do some deep breathing and think about that food and meditate on it and think, do I really want this food, or is this stress telling me that I want this food? It is profound. You will find happen. Same thing with talking to somebody. Let's say you're talking to somebody and you're really fired up, or you're really angry or worked up. If you take a minute and say, what am I doing? Why am I reacting the way I am? What does this say about me and the other person? Take a minute, breathe, and meditate on it. And meditating does not need to be what's in this picture. It doesn't need to be you sitting there like this. It's as simple as taking deep breaths. It's as simple as talking yourself down. It's as simple as, again, writing things down, going for a walk. You can close your eyes or not close your eyes. It doesn't really matter. But if you take that time to breathe, you have to center your brain. So meditation is key for decreasing, and meditation has been proven 100% to lower cortisol levels. Again, good old apps, Calm, Headspace. There's one called Smiling Mind. There's a ton of really great apps out there for this too. Sleep. So how many of you guys out there don't get over 6 hours of sleep a night? And if I had you in an actual room right now and you said no, I would be yelling at you. Not good. Sleep is the time that your body takes to recover. That's when your brain develops those, helps to create telomeres, which are your anti-aging little parts of your DNA. This is when your hippocampus repairs itself. Your hippocampus is your part of your brain that stimulates memory. You need sleep. 1 in 3 adults don't get over 6 hours of sleep at night. That is terrifying. Arguably, the only time somebody shouldn't get a lot of sleep is when they have a newborn baby or a puppy. Other than that, really should try. Now, if you are struggling with insomnia, that's something where you come in, especially with functional medicine, we can go over why. Why are you having this cortisol spike in the middle of the night? What are you going through? What are your cells going through? So sleep is huge. I urge you guys to really start paying attention to your sleep. 7 hours of sleep is necessary to bring cortisol back to its baseline level. So cortisol, like I said, kind of spikes in the middle of the night, and it needs 7 hours to recuperate. So that's it. 7 hours is still no short feat, but most people should be able to get at least that. So that's a huge, huge, huge thing I want you guys to pay attention to. So acupuncture points, back to this one. So this is that point that I was explaining to you guys, that one right here. So right in that kind of that puffy part of the thumb and index finger. This is called large intestine 4. So this helps to relieve stress, relieves tight muscles, and relieves headaches. So that is huge for you. That is a huge, huge takeaway. There's one called Shen Men. This is up in the top of your ear here. The purpose of Shen Men is to tranquilize the mind, facilitate state of harmony and serenity. This master point, that's what it's called, alleviates pain, stress, tension, anxiety, depression, insomnia, restlessness, and excessive sensitivity. Really powerful point. This is a miracle point. I actually have this point pierced personally. So I push on it throughout the day. I have a little earring there, and it helps with calming. So really cool point. So this might be my favorite thing to kind of talk about, and to give you guys a heads up too. We'll probably go for like another 5 minutes and then we'll be about done. So adaptogens. So what is this fancy word? So these are herbs that modulate this stress response in the body, and they turn down that inflammatory response that stress does. So with elevated cortisol, they decrease the output of cortisol. And with too low of cortisol, they increase the output. So again, fancy word, adaptogens, it means cortisol modulating herbs. There's quite a few of them that I like. These are just 3 that I chose. Rhodiola is one that improves brain function, reduces depression symptoms, fights fatigue, burns fat, enhances energy. So this is for those people that are feeling really low energy and need a boost. So that's rhodiola. Ashwagandha maintains homeostasis, lowers cortisol, balances hormones, prevents degenerative diseases, and reboots your immune system. Ashwagandha is my personal favorite adaptogenic herb. I take it every day. And then Schisandra boosts your mood, increases resistance to diseases, increases physical performance and endurance. So a lot of endurance athletes actually take Schisandra as like a little boost. Really powerful herbs. Again, if you're wondering, well, how do I know if I need them, or should I just try to take them? If we test your cortisol levels, we will really know specifically which herb you need, because you might be one that's a little more uplifting, or you might need one that's a little bit more calming. Just depends on your test. So those are wonderful, wonderful herbs. So this is coming away from like the chemical kind of like, in-office things we do. But this is something that I've found has helped a lot of patients manage their stress on their body and manage kind of all the moving parts of life. So it's time blocking. So if time management is the cause of stress in your life, time block your day or week. Some patients and some people go as far as doing something like this chart where they can put out each hour of their day and know what needs to be done. Some people, like me personally, I just do it week by week. And I know on Monday I have to do X, Y, and Z, Tuesday, X, Y, and Z, but I put them in order. But it helps, again, calming your mind. Some people don't struggle with the racing mind side of things, and some people do. This is more for the people that struggle with the racing mind, because then you just have everything organized. If you feel, I don't know if I have a racing mind, but I feel maybe just a little bit unorganized, this helps, because being disorganized can create a stress also. So this is a huge help. There also is an app. Again, there's one called Plan. I think people have fun with this one. I've gone through it with patients and I like it. So exercise. So I don't think I have to explain much about this one. But the cool thing about this is with exercise, there's actually two different forms of exercise that I like for people to focus on. So one is yin exercise and one is yang. Yang, everybody thinks is pronounced yang. It's not, it's yang. So the difference there, you could see here, if you are on overdrive and you're exhausted and really run down, you need yin workouts. This is like yoga, light weights, swimming, walking. If you are stressed, but you still have energy, utilize yang workouts. This is like running, biking, HIIT, so high intensity interval training, or heavy weights. How many times do you know people that they're over-worker-outers? They work out way too much and they burn their body to the ground, or they get injured, they get sick a lot, things like that. It's because they're doing too much yang much yang energy provoking workouts. You have to balance with yin workouts. You cannot, I don't care what anyone says. I don't think anything's ever proven that doing a HIIT workout 7 days a week is good for your cortisol levels. Absolutely not. You're going to run yourself to the ground, because imagine going and doing a really intense workout, really intense day at work. You come home to kids who need a lot of things, got to cook dinner, have a life, do your errands, all that, and somehow wind down by the perfect world of 9 o'clock. Impossible. You have to balance out by doing yin workouts, do calming, nourishing workouts that your body needs. Before you're about to do that workout, think about, what does my body want? Some days your body wants a run or wants a really high energy workout. Some days your body just needs to stretch and move. And that's what I want people to listen to. Now, people who are chronic exercisers, this is hard for them. You get really beat yourself up over like, oh, I didn't do my 10-mile run today, or whatever it might be. It takes a lot of practice. It takes a lot of work. Overworking out is probably the number one driver of irregular adrenal levels that I see in practice, believe it or not. So really, really important to focus on what kind of workouts are you doing? Are they good for your body at this stage of your life? For anybody that says I don't have time to exercise, I will look at you and say, no. Because if you don't have even 15 minutes out of your day, we got to reevaluate your day. That's what I always say. And again, you don't need a gym membership. You can just go out and get fresh air, just walk. If you don't have any weights at home, go get 2 cans of soup, do some movement, any movement. It does not have to be exercise, like going to a gym and lifting weights. movement. Dr. Sarah is huge on just finding movement that works for you. And we actually have a lecture later on that we're going to talk about that, is just move. It doesn't have to be this regimented exercise. That's another stress on some people. So just movement. All right, almost there. 3 more. The last ones are easy. Fresh air. So this is really, really huge too. I know it's hard for us in Northeast Ohio to get a lot of fresh air in the wintertime, but if you can at least get out and get fresh air for 5 minutes a day, science has proven time and time again, this is really good for stress levels. So decreases blood pressure due to the high amounts of oxygen. It improves cognition due to decreased stimuli, so stimulus around us, and the quietness calms the brain and reduces that fight or flight or that sympathetic nervous system. Fresh air is really key, and a lot of people, you know, especially when they got stuck in that rut of working from home and perhaps not really even leaving their house, go out and get some air. This will calm your cortisol levels and bring you back to baseline. Food. So anybody knows me knows that this is something I love to preach. I also will have a whole lecture on this coming up about foods that help decrease cortisol and how we can combat basically our entire hack our system with food itself. So there are a number of foods that help to decrease cortisol actually. Avocado, lemon, dark chocolate, oatmeal, and almonds. Everybody loves hearing dark chocolate. Dark chocolate is very good for a lot of things. Just make sure they don't add a lot of sugar to it. But food, again, circling way back to the beginning, imagine if you're just giving yourself a really stress-inducing food all the time, meaning like fried fatty foods or packaged foods low in nutrients. That's a stress on your body. So again, you could be happy as a clam all day long with no stress as far as like work or, you know, family or anything like that. But if you're eating poorly, your body still sees that as a stress. So we got to kick that out. So food is really, really important. And again, that's a whole lecture by itself. Here are my just tips, anti-inflammatory foods to decrease stress. So green leafy veggies, broccoli, beets, blueberries, pineapple, salmon, coconut oil, flax seeds, turmeric, ginger, water, half your body weight in ounces a day in water. I carry around this all day long. I drink like 20 of them. Just kidding, but something really high. It really helps decrease stress, the stress response in the body. Last one is breathe. So I want to talk about belly breathing a little bit. So belly breathing, you can see, is when you inhale through your nose, you hold it in your lower diaphragm. You see that left arrow there pushing way into the belly, and then exhaling out your mouth through that belly breath. So while you guys are sitting there listening to me talk, take a couple breaths like that. So inhale through your nose, push all of your air into your belly, and exhale out your mouth. You guys have probably commonly heard of 4-4-4 breathing, 4-6-8 breathing, 4-8-12 breathing. It doesn't really matter. That's when you inhale for a count, you hold it for another count in that deep diaphragm way down here, and then you exhale for a count. So before you guys go to bed tonight or whatever it may be, use this exercise and take a minute. Put a minute on your phone. It'll go quick, I promise. And do 4 seconds in, 6 seconds hold into your belly, and then exhale for 8 out your mouth. The better you get at this, the longer you'll be able to go. So you could inhale for 4, like I said, hold for 8, exhale for 12. You can really find your own rhythm and pattern. I love yoga and I love belly breathing. I love the calm aspect of that. So this is so amazing. And I promise you, you will notice a difference with breathing. So that was a lot of me talking, but I hope you guys enjoyed it and learned about stress. And I really want you guys, my biggest takeaway, my biggest win from this is if you guys can reflect on your own life and find what are the triggers that are making you stressed? What do I do about them? Now you have some tools of things you can do right away. And how do I calm myself when I'm feeling the stress? And when you feel this stress inching up, just remember, pretend I'm sitting on your shoulder yelling at you and saying, hey, calm down, breathe. But also think about, you know, my story, even when I ran myself to the ground and ended up in the hospital, you know, and that's happened to, quite honestly, a lot of people. Whether it's a hospital or a, you know, emotional break or an injury, you know, whatever it might be. So I really want you guys to reflect on stress in your lives. And I want you guys to remember, your life is precious. It's not meant to be stressed. My favorite motto is don't take life too seriously. Really calm yourself down as best you can. And we are here to help. We are here to help test for these things, to figure out why you're stressed. We're here to help give you nutritional advice on how to combat it, herbal advice, to really help you heal. With that, I want to read you guys one testimonial that was absolutely amazing. And hers was from a stress kind of response. So a patient of ours named Sarah, I'm going to minimize this so I can read these. Okay, there we go. Wrote us a beautiful testimonial. So she said, I'm not sharing my story to receive sympathy, but to simply share with you my journey. I have several health obstacles and have since I was 18 years old. But the major health obstacles that stopped me from doing my day-to-day activities were vertigo and dizzy spells, headaches, and arthritis, all before I even reached 30 years old. Scary. And how many times do we hear that happen to people? I had seen all of the recommended doctors within a 10-year span to help manage these obstacles and symptoms, such as a sports medicine doctor, a rheumatologist, and an ENT, or an ear, nose, and throat doctor. None seemed to help long-term. Actually, most of the doctors listed would do some tests, say I couldn't be fixed, and send me on my way. I'm not discrediting these doctors, but I'm simply stating my symptoms that seem to be unresolvable. This past December 2020, my dizzy spells and headaches were so constant, I figured this is just how my life was going to be, and I had to get used to being dizzy with head pain every day. I was at a breaking point and felt like there were no options left. The patient was also under a high amount of stress at this time. Until I met Dr. Sarah and Dr. Melissa. I started seeing Dr. Sarah for my arthritis and my headaches and occasional back pain. She did wonders in that category. I started seeing her once per week and graduated to once per month. I now rarely take Advil for headaches or arthritis pain because the pain is just simply not there. The dizziness was a whole different animal entirely. Have you ever gotten up from the floor too fast and felt a little lightheaded? Or maybe you had one too many drinks and started to feel that buzz from the booze. We loved her honesty with this. That's how I felt all the time from these dizzy spells. Even during the night while I was sleeping, I would get the spins. So what did I have to lose? Sure, I'll try acupuncture. I've always wanted to try it, but didn't really know what exactly it treated. And speaking with Dr. Sarah, she suggested I try it a few times to see what I thought. I was informed I had to try it at least 10 times for it to work. I thought to myself, well, of course, they want me to try it 10 times because that's more money for them. Boy, was I wrong. And she's totally right. The 10 is actually a magic number based off of research in acupuncture, side note. I kept a journal of every time I had a visit. Loved this about her. I listed the number of pins that Dr. Melissa inserted and where they were placed. I kept track of them and the ones that were rejected during the session and the feeling I had in between sessions. Rejected means when your body kind of pushes them out as the session goes on. By session 5, I started to feel a difference. The 10 visits weren't hocus pocus at all. I'm about to finish my 10th acupuncture session with Dr. Melissa, and last week I was able to ride my first roller coaster. This may not seem like a big deal, but imagine trying to ride a roller coaster with dizziness. Not ideal by any means. I'm also able to sleep flat on my back. She was not able to sleep on her back for months. Flip her hair upside down to blow dry it like a normal girl. Bend over to pick something up off the ground without being dizzy. All the things I was unable to do prior to my sessions with the Inspired Chiropractic and Wellness team. I'm not saying that getting adjusted by a chiropractor or getting poked with needles by an acupuncturist is the one and only way to get treated. What I am saying is to be open-minded and give it a try because you might be surprised. And again, it's not going to take 1 or 2 visits. You have to be committed and truly give it a chance. Your body is most definitely different than mine. So what may take 10 visits for me could take 5 or even 20 visits for you. I'm so grateful for these 2 wonderful women. I'm not sure I'd be able to continue my busy lifestyle without them. I've learned that it's essential to put your health first, no matter the cost or time commitment. I hope this advice helps you along your journey, whatever it may be. So those are the cool things that we hear that we absolutely love, when we see a response from patients. And this is just a reminder that we are here to help with your stress journey, and we're here to change your life and to really get down to the root cause and heal you. I mean, that's our job. That's why I believe, we were put on this earth. I think we all have a little purpose here. And these life-changing stories are things we see all the time. So once again, I want you guys, this evening or whatever it may be, take a couple minutes to just really reflect on, well, why do you have stress in your life? What is it doing to you? How can it help? And we would love to chat with you more about anything we can do to help you decrease that and bring that stress down in your life. So with that being said, I hope you guys have a wonderful weekend. And I just saw a comment from Sarah when I gave you guys a tour earlier. I hope you liked my little downstairs tour. I didn't see that. And thank you, Tori, for the clap. And then I hope you guys enjoyed it and learned something. And like you say, we're here always if you need help. And thank you guys coming live. It makes it more fun too when I see the people in and out. So that was awesome.